Good evening, Father. Good evening, everyone. I am Pavani from Varanasi and belongs to Edu platform. It is a pleasure to be here with you all on this section. I am incredibly grateful for the opportunity to express my sincere thanks to Father Selin and admin group. Reading part A, discussion, total knee replacement surgery. Total knee replacement. I would like to discuss 1 to 3 questions. Question 1. First, before discussing, I would like to tell the method. The method used in this part A is TQT. T stand for the scheme the text. Q for analyze the text for the keywords. T for the scan the text. What to scan in the text to get the answer? Scheme for the hedging words, topic sentence, names and numbers, synonymous language, phrases, visual clues, bullet points, sequential expression, modal verbs, and the time expressions. What to scan in the text, predict the answer with the examples like numbers, dates, and names, jump to the hedging words or keywords, scan the blocks, not word by word. By using this method, and we can find the answer easily. And I would like to add, write down the 4 test headings to help to identify the answer easily. When we write the answer, text A before TK, text A definition, text B clinical assessment, text C complications, text D post operative care. In the first question, the symptoms to check during clinical assessment. Keyword is clinical assessment. When we see the keyword, at once we can go to text B. Answer is text B. The second question, timeline to full recovery. The keyword is recovery. Then the recovery is in the text D. And third question, small operations as alternative to knee replacement. Keyword is alternative and smaller. So we can go to text A. The smaller operations is mentioned in the text A line 10. After there is a modal verb over there. Before the modal verb, smaller operations are mentioned. So I use the TQT method and find out the answer easily. Thank you so much. Thank you, Father.
Thank you, Bhavani, for a better explanation for question 1, 2, 3 and how to select the keywords. You are using your fully for the strategy, how to skim the keywords. So now I would like to call Valli Prabhakar for question number 4 to 7.
Good evening, Father, and all admin members. I am Vali Prabhakar. I am one of the EduSkills aspirants. Thank you for giving me this opportunity. Today, I am going to discuss question number 4 to 7 on total knee replacement. Here, as Pavani explained, we have to first match the headings. First, we have to do the text matching. So first, we have to which text is we have to keep a heading. So as Pavani explained, we have given 4 texts. For text, we have the headings. After we see the questions, first we have to follow the TQT method. First, we have to do in the text, we have to do the skimming. While doing skimming, we have to underline the headings, subheadings, the names, and all we know. First, we have to do that. Then we have to go to the question. In the question, first, what we have to do, we have to underline the hedging words. That is will be easy for us to locate the text. So, for fourth question, post-operative care following knee replacement. In this, we have to underline the hedging words post-operative care. As we skim the text, we have underlined the headings and subheadings. So we immediately we can know which text it is. So we have to go to the text and then we have to scan for the answer. So here it is a matching test. Just we can write the what text it belongs. So that is enough. Here immediately we have seen the hedging words post-operative care. It's very easy. We have underlined the heading. So in the heading itself, in the text for post-operative care is mentioned. So easily we can write this post-operative care. So it belongs to text 4, that is text D. Next question. Question number 5, potential complication. Here, the potential complication is the hedging words. Once we read the hedging words, again we have to go to the text. Immediately we know where we have read the potential complication. In text C, we have seen potential complications. So we have already underlined the heading is a potential complication. Now we know this is from the text C. So the answer is C. Then question number 6. The reason a patient need to seek medical help after discharge. Here, what is the hedging word? It says to seek. When to be seek the medical help after discharge. So immediately we have to go to the text. Which text it is comes. So where we can see the medical help after discharge while doing skimming, we may underline the text. So we can go to the text. I think it's from the text C. In the text see here, the third bullet point we have seen. Also, patients here, the operated leg will be bruised, but patients are advised to seek medical help if they find the leg is becoming hot, reddened, hard, or painful. Here they have mentioned when to seek the medical help. So this is the uh, in this text they have mentioned the when the medical help to be seek after the discharge. So this question is from the text C. So we have to write C. So one confusion I actually have usually might had this after discharge. Once we say the after discharge, immediately we have to go to where we have seen the text 4. It is in the after discharge, but we have to see there. But they didn't mention the when to seek the medical help. So we immediately where we have seen the medical help in the text 3. So we have to write the text C. Next question, question number 7. What is total replacement is? Here they are asking about what is total knee replacement. What this means, definitely we know that is from the definition. So immediately we'll go to the definition text where it is in the text A. So we can go to text A. Here, see in that this is the text A. It's all about definition. We have already given the heading to the text. So it's a total knee replacement. Here they have given the what is knee replacement. This is surgery. Is a major but routine operation performed to reduce the effects of damage, worn or diseased knee with an artificial joint. So this answer is here. So we can write text A. According to the further strategy, we have given to the answers. So this how we have to identify the answers. Thank you, ma'am. Thank
Thank
you
you,
all.
Mary, for a better explanation for question 4 to 7. Thank you, Ravi. So now I would like to welcome Soni Sajil for question number 8 or 9.
Good evening, Father, and good evening, admin. Thank you for giving an opportunity for participating in this discussion. Today, I am going to tell about the question number 8 and 9. 8 question, I mark the keyword like analgesia. So we know analgesia when we are giving this analgesia during the surgery. So test 4, it is a post-operative care. So that is that there we are telling about the analgesia. So the under post-operative care, I marked the keywords like deep vein thrombosis, bolus analgesia, number like 24 to 48 hours, oral medicine name non-steroidal anti-inflammatory, and one instrument device name is the intermittent footstool pump, crunches, physiotherapy exercise. So in that one highlighted word is PCAS. So there it is mentioned opioid analgesia is administered using a patient-controlled analgesia system. So I selected the answer for that one, 8th question, opioid analgesia. Then next one, what do the initials PKR stands for? So it asking for any some definition. So we know in part A, I marked part I marked as a definition. So under definition of total, and there we can see PKR 20 years number is there, age 60 and 18, and contrast word is there, however. So in that, I noticed one word is there, PKR. Though this PKR stands for partial knee replacement. Like that, from this way only, I selected the answer for this 9th question. Thank you.
Thank you, Simon. For how she is beautifully explained to you the father's strategy, and she explained very well how we can highlight the keywords and how, like father already explained in scheming and scanning, how we can highlight the abbreviation, how we mention any drugs name. So she used the father's strategy, and she very well to get the answer. Thank you so much, Sunny. Now I would like to call Anita Tas for question 10 to 11.
Greetings all. Hi, I'm Anita Taj. I live in Dubai, and it's my pleasure to be in Edu Skills family. First of all, I extend my sincere thanks to God and Father Salim Joseph and all the admin panel members for the great support and day by day you are giving to me and all the aspirants. And thank God for, thank everyone for giving me the opportunity to share one of my learning experience as well. Even though I'm not fit or ready to be give any explanation much, but what I understood, I will try to do my best. The questions which I should explain is 10, 11. Here we have already given name for each text. So when we're coming to question number 10, question number 10 is a answer to the question type. So we have to answer in a word or in a short phrase. So what are the most common complication? So this is the question. So after following the total knee replacement surgery. So immediately when we come to the question, when we highlight the keyword, we can understand common complication means it is under which heading. We can understand it comes under complication. That is text C. It's already given, and it's already in the topic sentence. Clearly, it has been said that infection and blood clots. So directly we have to copy and write the answer without any change. So when, as we all know, when we do the proofreading, if there is any mistake, we can make out. But when we write, we have to write without any mistakes. And next question, 11. So this also a answer to the question type. So we have to add a word or a short frame. So first of all, we have to understand the keyword. So when we see the keyword during the clinical assessment, so what a physiotherapist will assess. So immediately we will understand this is from the text B, clinical assessment. So we have already during our skimming and scanning, we have underlined and highlighted the points and clues. Physiotherapy assessment for mobility and gait. So easily we can write the answer to the question.
Thank you, Anita, for how she's beautifully explained to question number 10 to 11 along with the father's strategy. So thank you so much. So now I would like to call for question number 12 to 13, Tommy Lee.
Hi all, my name is Tommy Lee and I am one of the students on the EduSkills platform. First of all, I sincerely thank our mentor Father Salim and the entire EduSkills team for your valuable support and precious time to giving to us. Always the EduSkills platform helping me to study and empowering in my day-to-day life. Today I'm going to share question 12 and 13. The question 12 is, what is the main reason a TKR is carried out for? As per father's strategy, we have to analyze the question. So how to analyze the question? What is the main reason a TKR carried out for? From that question itself, we can mark it out the main key points. Main reason and TKR are the main points. So through the first passage, we already marked the main reason and TKR. So we can easily find out osteoarthritis is the main reason for a TKR Other reasons include rheumatoid arthritis, knee injury, and knee deformity. So the answer is osteoarthritis. 13th question. What is the minimum knee bend a patient should have a discharge from hospital? How to analyze the question? Identify the focus word the question, minimum knee bend, the lowest required degree of bending on discharge from hospital, not before or after. We have to focus these 2 points from the question. Identify the words from the question. That the first word is minimum knee bend and the second word is on discharge. So while we focusing these 2 words in the part from the paragraph, we can, from the question itself, we can understood the answer will be in the discharge part. So that is the text 4. In the text 4, it is mentioned bend their knee well, preferably the minimum of 90-degree angle. So as for further strategy, we just need to copy and paste, nothing more and nothing less, like 90-degree angle. So it is easy to find out that steps also. That's all about. Thank you very much. Thank you for listening me.
Thank you, Tomily. Thank you again. How she's beautifully elaborated the question, like in which thing we need to focus and which thing we don't need to focus. Anita, yeah. Question number 16 to 17.
Hi, okay, I'm here, Anita, again. So 2 more questions, 15 to 20 questions. So in that, it is a fill in the blanks type of question from reading part A. So here also, we have already explained, we have already given the text names. So now when we go to the hedging words, we will understand this is from which text. So here a person may report knee and we have to fill the gap, and when we continue that when we underline the hedging words like clicking before and after the gap, after the blank space, so we have to look for the same words, or maybe sometimes synonymous or synonymal expressions may come, but now here it's given directly and we have to just copy and paste, locking into the gap. I think this is clear for this question. And 17, yeah, when we come to 17, so 17 also from also for fill in the blanks type of question. Here the answer is from the text A. So when we read this question, we will understand that this is regarding the description, I mean about the surgery of after the knee replacement surgery, when artificial knee joint. So there is a material name or something. So when we understand that directly, we can go to text A and we will find out the word cement, and the sentence can be filled with that word. Thank you so much.
Thank you, Anita. She explained very well, and Father already explained that when we are doing to fill up question, so what we need to do, we need to focus before and after. She already explained. Apart from that, we need to focus on scanning techniques. Father already explained. So thank you so much, Anita. So now I would like to call Jia. So question number 18.
Good evening, Father and admin team. First of all, I am giving for this opportunity. Myself is Jaya. Today I am explaining about question number 18. Question number 18 is question. It's on discharge. Most patients are able to walk. Dash, that is the filling the blanks questions. It is before and after we have to must as per the sister Anita told this same only we have to follow, and go up and down stairs with walking aid. Actually, first we are skimming time. We have to watch the immediately. We have to go to the on discharge. On discharge means it is directly we can go to the post-operative. That is the text D. That first of all we have to the skimming time. We can go to there. The next is most patient is there. Most is the scale. As per the father strategy, we have to go to the scale strategy. That also it is mentioned. This most then are able to walk. Itself it's in the paragraph. It is showed. It is are able to walk. Walk. It is paraphrasing. Like walk 10 meters and go up and down. The same only, but as walk. we have to go to the direct 10 meters. Then it is easily, this is direct questions we can find easily. Even, but we are writing the copy paste. As per the father told, it is no need to change anything. Okay, directly we have to copy paste like 10 meters. We have to write 10 meters only, not 10 m or 10 mts like that. No, only we have to copy paste. Thank you.
Thank you, Jaya. Thank you so much. Explain the question number 18. And as per this father strategy, I would like to add something because I learned. So that's why, because father already explained that, like in a 15 to 20 question, it's a and, it's a conjunction. If we are
Yes.
too much familiar, like if we are English are strong day by day, and we know very well it's and is a conjunction. And father, they already talk about that modals most. When we are just skimming the paragraph and we just highlight, okay, most, where is the mentions the most and anything, because where is the and? It's they are just adding to two sentences. So easily we get a second clue in our OET, like in a reading for part E, because question number 15 to 20, they most of the question like in if and or, most of the conjunction we most of the question we can see in 15 to 18, it's conjunctions and inspections based type of question. So thank you. Question number 20, Arshia Akbar. She's here.
Good evening, everyone, and thank you for giving me opportunity to explain this question. The question is dash and lifestyle changes are the first choices for managing the knee symptoms. So first of all, as everyone explained, according to the further strategy, first of all, we will go for the headings of the paragraphs. If they are present, we will write it as it. Otherwise, we will create the headings using the topic sentence and the headings and subheadings. By merging these all, we will create the heading and we'll write on the top of every page of the booklet. So after this, we will use the technique TQT. First of all, we will go for the skimming of the text, and for this paragraph, while do skimming, I find the visual clue, that was the list of the words, the three words. Yes, here it is underlined: the medication, physiotherapy, and the lifestyle changes. This is the list of three words. So it is included in the visual clues. So I underlined these, and then we will go to the question analysis. While doing question analysis, we will find the keyword. The keywords were clues that were the lifestyle changes, first choice, and the symptoms. So it show me to go to the as it is definition and the lifestyle changes and the management. So the in the part A, I go there, and then after scanning, in last scanning the text. While doing scanning the test, I directly go the underline, that was the list of the words: medication, physiotherapy, and lifestyle. So medication and physiotherapy is the answer in this. So we will just copy paste, and no repetition of the words and no additional word. That's it. Thank you.
Thank you, Arshia, for a better explanation for question number 20. So anybody doubt for 1 to 20 questions, so you can ask.
My name is Mukta. Can I ask a question? It is not regarding this 1 to 20. Maybe this A session, I have a little bit gap of knowledge. That is TQT method. We are following when we solve the questions, we write locate the answer like A or B or C, like that way. So when we skim the text, we go to the questions and we highlight the hedging word, and we mark the A, B, C, D like that way, which are where our questions location like that way. So my less of understanding here that when we scan the 1 to 20 questions, hedging the questions, that time 1 to 7 is A, B, C, D. Okay. And after 8 to rest of the questions is when I mark the hedging word and locate the questions. So individual questions, like when I mark the 8 number questions and locate it is B. So that time again I go back to scanning, or I complete 20 questions same manner, and then after that I go for scanning.
Yes, Mukta. As you said that, like as per the father strategy, and in the beginning stage, might be it's not gonna be necessary after you go for like somewhat time, but in the beginning stage, you like as per the father's like the technique, he is explaining to go for like the when you start with like the just skim the text, like find the main like the important words, whatever the 14 different types are, like the name and the abbreviation and all, and just underline that one, and then go to the like the questions. First 1 to 7, just find like the hedging in the hedging, like when you see the question, like try to understand the hedging word. What is the hedging word? Try to find like write that number like A B C D, what text it comes from, and in 7 to 20, like once write down for the all the questions, write down the like which text the question comes from, and then go to the text. So it will be more like the kind of like the, I can say it's gonna be helpful, like you can understand like the which information is coming from the which text.
Okay.
So after you are going back with the text, it's gonna be easy for you to like find out the answer.
Okay,
Hope I
that is,
clear.
yes, and
Okay.
that is the point I miss for my
Okay, yeah.
understanding perspective.
Yeah,
Thank you.
because if you're going with like one question, if you're just doing like the 8th question, you like you are reading the question, you are finding the hedging word, you're writing that it's comes from the text A, B, C, or D, and then you are going back to the like the text. It's not gonna be helpful because you are going one by one question. But if
Yes,
you are going for like after five, like another thing you can do, like first write down in the all the question, like it's text A, text B, text C, or text D. Then in the initial stage, like just find like what questions comes from the text A. So just go in the text A and find out all the answers. That's another technique. You can go for that one too. But it's better to start with like one by one. Just go with all the questions, finding the text. And then if you're okay with the like the text, then just go and find the with the hedging word, find the answer.
Okay, I got your point. Thank you.
Yeah, no worries. Thank you, Anju, for taking the coordination at the last moment. And thank you all the aspirants. It was really wonderful explanation. And in the beginning stage, this is gonna be really helpful. Like I was like we everybody was in the last batch, and we improved a lot ourselves after going with like the daily discussion. So we are requesting everybody to please join in the daily discussion. It's gonna be beneficial for sure. You will see the improvement in yourself. And if you're not good with the making PPT, you can take the screenshot from the father's video. Even you can do like just write down on the paper and like just take the picture, and you can send the that picture to the mini. That's gonna be also fine. Like we don't need the actual PPT. Yeah, just edit your picture, like whatever you're sending, just edit that, like you are sending just 1 or 2 picture or 3 pictures, but she's like gathering all the like 20, 25, sometimes like 30, 40 pictures, and she need to do the editing and all. It's hard job for her. So if you are like being little bit coordinate, it's gonna be really helpful. Just try to do your best, so it's gonna be little bit easy for everybody. And we are gonna start like the officially daily discussion from the Monday. So you guys will see like the daily task and everything in the beginners batch. So please, like if you wanna go for the questions or whatever you wanna go for, you can write your names, or you can just mention to anybody like you wanna go for that question.
Okay, thank you.
Okay.
Thank you.
Thank you all the aspirants.